Reimagining Rural Health, a podcast series brought to you by Sanford Health. In this series, we explore the challenges facing healthcare systems across the country, from improving access to equitable care, building a sustainable workforce, and discovering innovative ways to deliver high-quality, low-cost services in rural and underserved populations. Each episode examines how Sanford Health and other health systems are advancing care for the unique communities they serve. In this episode, Courtney Collin with Sanford Health News talks with Dr. Alex Oshmiansky, founder and CEO of Mark Cuban Cost Plus Drug Company. Dr. Oshmiansky is a speaker at the 2024 Summit on the Future of Rural Healthcare with the topic Disrupting Healthcare, Prioritizing Affordability, Trust, and Patient-Centric Solutions.
So we're so happy to have you in Sioux Falls. Welcome.
Oh, no, thank you for having me.
As the founder and CEO of the Mark Cuban Cost Plus Drug Company, innovation is in your DNA. We know that. Can you tell us what programs or policies you think should be in front and center today and soon to impact affordability, trust, and patient-centric solutions in healthcare?
Yeah, with us, it's all about transparency.
Yeah.
It's probably, certainly not a panacea solution to everything, but it's certainly a prerequisite before we can get anywhere. Mm-hmm. If you don't know what the actual cost of the product or service is, how can you anticipate being able to negotiate it for it in any way, shape, or form? And, I think that goes not just for pharmaceuticals, but healthcare more broadly. In classic economic theory, if you have an opaque market, the winners are not the buyers, they're not the sellers. They're the people that broker information in between. So like when Goldman Sachs sets up a dark pool of equities, the winners are not the people buying or selling equities. The winner is Goldman Sachs. And you see that happening in healthcare to an enormous extent. You see struggling health systems in every state. You see generic pharmaceutical companies struggling to keep their lights on. And yet everybody knows healthcare and pharmaceuticals are unaffordable for everyone. Mm-hmm. So really we're all about, hey, just post the prices for all parties involved in healthcare. It's actually going to wind up better, not just for the patient, but seemingly paradoxically, also for the provider as well.
This past March, you visited the White House along with your partner, Mark Cuban, to speak to a roundtable on the topic of lowering healthcare costs and bringing transparency to prescription drug intermediaries. Can you tell us, Dr. Oshmiansky, about that experience and what you think is the next crucial step in disrupting healthcare?
Yeah, just on an anecdotal, personal level, I'd never been to the White House before, so that was super neat.
I bet.
Yeah, never even did like the school tour or anything, so that was just cool to see. But yeah, absolutely. Again, we were very focused at that meeting on PBM reform, so pharmacy benefit managers, and since they control effectively the entirety of the pharmaceutical distribution market, or at least the payment processing market, like the way they're structured is very convoluted, but this is effectively what happens.
Right.
By the time for any given drug, they can at least double or triple the cost. So the easiest way, obviously it's a complex multifactorial problem, but the sort of low-hanging fruit from our perspective is let's reform the payment processing piece of it, because surely that's the least value-add component of the healthcare system, and at the same time seems to have the highest margin. So if we can start there, we can move on to more substantive problems further down the road.
Former FDA Commissioner Dr. Scott Gottlieb spoke on the topic of navigating healthcare's next chapter, innovation, AI, and the future of patient-centered care. I'd love to hear your take on AI and how it's impacting healthcare. Where do you stand?
Oh, sure. So part of my background, so I'm a MD, PhD. The PhD is actually in applied mathematics, and I'm actually a visiting faculty member this semester at the University of Southern California, studying mathematics of artificial intelligence. So,
fantastic.
Yeah, I've gotten really into too far down the rabbit hole on this one. But yeah, I think the important part, the people that seem most enthusiastic are technologists who don't really know much about medicine, and people in medicine who don't know much about technology. I think it's really having both sides in communication about what are the low-hanging fruits in terms of what the applications can be, what the technology has to be. Certainly LLMs, transformer architectures are, no pun intended, transformative for the industry as a whole. But, they have a number of issues associated with them, hallucinations, inaccurate outputs. Like, how do you train the models in order to have really substantive, meaningful impact? And I think we're reaching a point where the models themselves can almost be commodified. Claude versus Sonnet versus Llama versus Gemini. And the real value is actually in the data for training the models. And I think the healthcare systems are beginning to understand the value of the data they have. So, yeah, it'll be a really interesting time commercially as all these dynamics sort of interplay.
Yeah, and those California students will have a lot to learn from you. That is fantastic. I would love to hear what innovation or action do you think it'll take to move the needle most, say, in the next few years?
Yeah, I think it's, Mark and I are both on the same page that I think it really does have to be a private sector solution to all these problems. So, we went to Washington, we go periodically to Capitol Hill, but really the mechanisms that are driving these pathologies, these arbitrages in the healthcare system are so convoluted that any attempt at regulation or legislation sort of nips around the edges. The PBM reform measures that are currently on Capitol Hill generally revolve around spread pricing, rebate policies. And the big PBMs have already come out in their quarterly earnings calls and said, if these reforms are implemented, they don't anticipate a meaningful commercial impact to their business, meaningful financial impact. So really, I think the long-term sustainable solution for this is for large employers, including health systems, because generally they tend to be the largest employers in their communities, and particularly rural communities, to realize, hey, we should move off of them onto the smaller, transparent alternatives. Because, there's nothing those small PBMs can't do that the big players can. If anything, you tend to get better customer service with the small guys because they really want your business. I think as the industry as a whole, as employers realize, hey, we're getting really ripped off here, and move to more transparent solutions, really the private sector, I think, is going to be the one driving meaningful reform for the PBMs.
Thank you. While in graduate school, you founded a startup dedicated to reducing the rates of specific diseases in hospitals called Altitude Medical. The company continuously operating now for over 14 years. What impact, Dr. Oshmiansky, have you seen with this innovative idea?
Yeah, so that was a real learning exercise. I started a company when I was it's been 20, 21 years old.
Amazing.
And at the time, getting a startup funded was in my mind something like, becoming an NBA player or something, or a rock star. It's a fantasy that doesn't really happen. And turns out, no, if you have a good idea, you can raise money for it and get it off the ground.
Absolutely.
Yeah, but sort of went out. And actually what wound up happening with that, so we sold it. The intent was to keep doctors and nurses from forgetting to wash their hands going between patients, because I'm a putz and I forget to wash my hands, so I don't want to accidentally hurt anybody.
Honest mistake, yeah.
Yeah, but actually where it wound up having the most impact, most sales, was actually in hospitality and food processing.
Really?
Yeah, so we sold them to a lot of fast food restaurants, a lot of hotels that didn't want to, think cruise ships. They didn't want to prevent the norovirus at the time.
Absolutely.
And it was a real education as to the unique dynamics that hospitals have in terms of sales into hospitals, because oftentimes the physicians, the providers that want a certain product, their incentives are not aligned with the purchasers. And it was a really great learning opportunity for further projects to understand really how the supply chain works for health systems.
Incredible work. And I'll wrap it up with this. Is there a book you're reading right now, or a book that was influential in your career thus far that you'd like to share with us?
Oh, honestly, I'm just, when I get a little downtime, I just try to read fiction, or alternatively, books that are, relevant for work. I'm reading a big textbook on how payment processing, works at the moment. But I'm reading also 100 Years of Solitude.
Okay.
Yeah.
I've heard about that one.
Yeah, it's a lovely book.
Yeah. Well, we thank you so much for your time and for being here in Sioux Falls at the 3rd Rural Health Summit, and of course, as a guest on our Reimagining Rural Health podcast. Thank you so much for your time.
Thank you so much for having me.
Thank you.
You've been listening to Reimagining Rural Health, a podcast series brought to you by Sanford Health. Hear more episodes in this series or other Sanford Health series on Apple, Spotify, and news.sanfordhealth.org.